It's time for your surgery. The day before your procedure, you will receive a call to let you know what time your surgery is scheduled. Remember to arrive 2 hours before your scheduled time, unless you are told something different. Please remember that while you are given a time for your surgery, sometimes the schedule changes or delays occur. Please ask if you have questions about the timing of your surgery. When you arrive at the George Washington University Hospital, go to the admission office on the first floor. It is located above the lobby and right next to the gift shop. After you have checked in, you will be taken to the pre-op holding area near the operating room. Here, you will change into a hospital gown and meet with your surgeon and anesthesiologist. The anesthesiologist will explain the type of anesthesia you will receive, how it will be administered, and what you can expect. If you have a history of severe nausea with anesthesia, be sure to mention this to your anesthesiologist so additional measures can be taken to minimize any nausea after surgery. If you have any additional questions for either your anesthesiologist or surgeon, you can ask them at this time. A family member or caregiver will accompany you to the preoperative area and can ask questions as well. Other family members or friends in limited amounts may also join you in pre-op. They can check with staff members for information, and staff can update them as you proceed from surgery through post-anesthesia care. Orthopedic surgery is a successful and safe procedure. However, complications can occur. Your surgical team, anesthesia team, and nurses will do everything to make sure that your surgery and recovery are smooth. With improved anesthesia and surgical techniques, blood loss with surgery can be minimized. However, some patients may need a blood transfusion. If you have religious or spiritual preferences that would affect you being able to receive a blood transfusion, please make your surgeon and anesthesiologist aware. When the operating room is ready for your surgery to begin, the anesthesiologist will give you a medication through your IV to help relax you. You will then be brought back to the operating room. When you are brought into the operating room, a nurse will greet you and verify your name and surgical procedure. The anesthesiologist will set up different monitoring equipment, including EKG leads and a blood pressure cuff, to make sure that you are comfortable and safe during surgery. After your procedure, you will wake up in the recovery room. You may experience blurry vision, dry mouth, chills, nausea, sore throat, and pain or discomfort. This is normal. How long you stay in the recovery room will depend on your surgery and how you respond to the anesthesia used. It can be as quickly as 2 hours or longer. Your caregiver will be allowed to visit with you in the recovery room after you are awake. From here, we will begin your rehabilitation process.